Hi, my name is Sierra Brown, and our group is talking about tuberculosis, and I will be covering the history and additional facts on tuberculosis, the etiology, and the signs and symptoms. Tuberculosis is an ancient disease that has been found in the skulls and spines of Egyptian mummies. Hippocrates, a Greek physician, noted that tuberculosis, also known as consumption, was the most widespread disease and fatal to all infected with it. In 1800s, the disease caused more than 30% of all deaths in Europe. During this time, tuberculosis was called the White Plague. The disease was finally named tuberculosis in 1839 by L.J. Schulin because of the numerous tubercles or holes formed in the lungs by the bacterium. In 1882, Robert Koch wrote a paper on his studies of tuberculosis. It was thought to be hereditary. However, Koch proved it was in fact from a slow-growing bacteria, Mycobacterium tuberculosis. He received the Nobel Prize for his discoveries. In 1905, Albert Calmet and Charles Guerin invented the first vaccine at the Pasteur Institute in France. Finally, in 1943, Dr. Silman Waksman discovered streptomycin, which was the first antibiotic to be effective in treating tuberculosis. This is one of the top 10 causes of death worldwide. In the United States, about 10% of people with tuberculosis die of the disease or related condition. In other parts of the world where tuberculosis is common, the percentage is much higher. In 2015, 10.4 million people fell ill with tuberculosis and 1.8 million died from the disease. It was estimated 1 million children became ill with tuberculosis and 170,000 children died of the disease. Tuberculosis is a leading killer of HIV-positive people. In 2015, 35% of HIV deaths were due to tuberculosis. On a more positive note, thanks to immunizations, an estimated 49 million lives were saved through tuberculosis diagnosis and treatment between the years 2000 and 2015. Or TB is a bacterial disease caused by the bacteria Mycobacterium tuberculosis. This bacteria does not have the chemical characteristics of gram-negative or gram-positive. The cells do not stain and therefore are sometimes referred to as ghost cells. However, they do contain a peptidoglycan cell wall, which also contains myocolic acids in the cell wall. The bacteria is large and rod-shaped or bacillus. It is a non-motile bacteria and does not produce toxins. However, it does have pili. Mycobacterium tuberculosis pili, or MTP, helps in adherence and in the initial colonization of the bacteria. This bacteria is an obligate aerobe, meaning it can live only in the presence of oxygen, which is why it is most often found in the well-aerated upper tubes of the lungs. It is important to note that not everyone that is infected gets sick. Those that do not exhibit signs and symptoms of the disease yet are infected have a latent form of tuberculosis. About 1/3 of all people in the world are thought to be infected. Most have a dormant tuberculosis infection. Only about 5 to 10% of these infections progress to active tuberculosis. At any one time, about 11 million people worldwide have active tuberculosis. Active tuberculosis usually attacks the lungs, but it can also attack any part of the body, such as lymph nodes, kidneys, brain, heart, and intestines. Common signs of active tuberculosis are persistent coughing 3 weeks or longer with sputum, sometimes containing blood, shortness of breath, fever, night sweats, weight loss, Symptoms are weakness or fatigue, chest pain, no appetite, and chills. Other area-specific signs and symptoms depend on the affected area may include lymph nodes, which is more common in children. Infected lymph nodes produce a brassy cough and possibly a collapsed lung. Infected lymph nodes in the neck can break through the skin and discharge pus. Infected kidneys may cause fever, back pain, and sometimes blood in the urine. The infection can spread to the bladder, causing more frequent and painful urination. Tuberculosis can also spread to the genitals. In men, genital tuberculosis causes the scrotum to enlarge. In women, it causes pelvic pain and menstrual irregularities and increases the risk of pregnancy in an abnormal location. Tuberculosis in the brain, also known as tuberculosis meningitis, is life-threatening. In the United States and other developed countries, it is more often seen in elderly and those with a weakened immune system. In developing countries, it is most common in children ages 0 to 5. Symptoms include fever, constant headache, neck stiffness, nausea, and drowsiness that can lead to a coma. In tuberculosis pericarditis, the pericardium thickens and sometimes leaks fluid into the space between the pericardium and the heart. These effects limit the heart's ability to pump and cause swollen neck veins and difficulty breathing. Intestinal tuberculosis occurs mainly in developing countries in which tuberculosis in cows is a problem. It is acquired by eating or drinking contaminated, unpasteurized dairy products. This infection may cause any symptoms. This infection may not cause any symptoms, but can cause irritable bowel syndrome with pain, diarrhea, blockage of the intestine, and passage of bright red blood from the anus. Tissues in the abdomen may swell. This swelling may be mistaken for cancer.
Hi, my name is Courtney, and I will be talking about the transmission of tuberculosis. Tuberculosis is an airborne contracted disease. The bacterium M. tuberculosis is carried in airborne particles called droplet nuclei. M. tuberculosis is the bacterium that causes tuberculosis. M. tuberculosis is 1 to 5 microns in diameter, which means they are extremely small. The droplet nuclei can survive in the air for several hours depending on the environmental conditions. Droplet nuclei containing M. tuberculosis is dispersed in the air when a person who has tuberculosis coughs, sneezes, shouts, or sings. This disease cannot be contracted by surface contact, only through airborne contact. When droplet nuclei are in the air because someone with tuberculosis coughs, sneezes, shouts, or sings, transmission of tuberculosis can occur. It can occur when someone inhales a droplet nuclei containing M. tuberculosis. When a person inhales droplet nuclei through the mouth or nasal passages, it then travels to the upper respiratory tract and then to the bronchi, which then reaches the alveoli of the lungs. This picture on the right shows the transmission of tuberculosis. The red dots are the droplet nuclei, and the person on the right is the one contracting the disease. There are 4 factors that contribute to the probability of transmission of tuberculosis. The first factor is the susceptibility of the person contracting it, which means the strength of their immune system. Being ill makes a person more susceptible to contracting tuberculosis because their immune system is already weak. The second factor is the infectiousness of the host of tuberculosis. The person with TB can expel a lot of droplet nuclei containing M. tuberculosis, which makes the probability of contracting tuberculosis high. The person infected with TB can also expel little amounts of droplet nuclei, which means the probability of transmission is lower. The third factor is the environment. The environmental factors such as air circulation, air pressure, and ventilation can affect the probability of transmission. The last factor is exposure. Exposure means the proximity, frequency, and the duration of exposure can affect the probability of transmission of tuberculosis.
Reservoir. The only known reservoir for tuberculosis are humans. A lot of research has been done to find the starting point of the disease, and it turns out quite surprising. It seems that tuberculosis has evolved with humans. It migrated with them all over the world, and that is why it's all over the world today. And that's also why you have different strains of it. Treatment for tuberculosis takes a while. Most treatment plans have you taking pills for 6 to 9 months. Treatment depends on the type of strain that you have and whether it is active or latent. If it is a drug-resistant strain, then you will need to take multiple types of drugs at once to make sure all the bacteria are killed. If it is a simple strain, then one type of drug is usually sufficient to cure you. It is imperative that you take all of your pills. The symptoms of tuberculosis might go away after a few weeks, but that doesn't mean all the bacteria are dead. If you stop taking your pills, then the remaining bacteria will become resistant to the drugs you are taking and become a lot harder to kill. Prevention and control. There is a vaccine called the Bacillus-Calmette-Guerin vaccine that other countries outside the United States use. The United States doesn't use it because we don't have a lot of the tuberculosis bacteria in the US. It helps tremendously to prevent tuberculosis. Other than that, the only way to help contain it is to cure it. If diagnosed with tuberculosis, there are a couple things you can do to help not spread it. First, sleep in a well-ventilated area. Second, be outdoors as much as possible, but away from large crowds. Go for a drive with the windows down, or go to the countryside and take a walk. Third, you need to practice good hygiene. It's highly recommended that you do not sneeze or cough in another person's face. Cough in your elbow and make sure you wash your hands thoroughly. Make sure that you do these things so that we don't spread tuberculosis to other people.